Welcome back. We are officially on part 15 of our 20-part dental coding masterclass explainer. If you've been with us so far, you know we're meticulously breaking down the CDT code set to help you master the revenue cycle and, most importantly, avoid those totally unnecessary claim denials. Today is a big one. We're diving into a monumental part of dental coding, Category 1, Diagnostic Imaging. We're going to clear up all the nuances of radiographs, exactly when you need a base code versus an add-on code, and how to steer completely clear of those super frustrating frequency denials. Let's get right into it.
Here's a quick look at our agenda for today's explainer. We'll start with our welcome and objectives, move right into periapicals and the full mouth series, decode bite-wing radiographs, tackle panoramics and their tricky frequency rules, and then wrap it all up with a summary and a teaser for next time.
All right, Section 1. Welcome to Part 15, Diagnostic Imaging.
So building on Part 14, where we mastered clinical oral evaluations and pre-diagnostic assessments, today is all about the images. We're strictly focusing on diagnostic imaging codes ranging from D0210 all the way to D0330. But look, we aren't just here to memorize numbers, right? We're going to really dig into how to strictly navigate carrier frequency limits and co-billing guidelines. Because let's be real, capturing the image clinically is only half the battle. Knowing the exact code combinations and the timelines, that's what actually gets the clinic paid.
Moving on to Section 2, Periapicals and Full Mouth, the micro to macro view.
Let's start by looking at D0210, the Full Mouth Series, or FMX. This code is your comprehensive baseline. Clinically, it requires a complete series, which typically means 14 to 22 distinct periapical and posterior bite-wing images. Now, you might be wondering, why that specific number? Well, it's pretty simple. That's exactly what it takes to capture the entire oral cavity. And trust me, insurance carriers will absolutely be counting to make sure you hit that threshold. They expect to see a truly complete diagnostic record before they even think about processing that claim.
What's really interesting here is how the D0210 FMX fits into the bigger billing picture. You'll frequently, and appropriately, co-bill it right alongside specific hygiene and periodontal codes. For instance, you'll see it a lot with D1110 and D1120 for standard prophylaxis. But it's also absolutely crucial for establishing the medical necessity of deeper treatments. That's why it's commonly co-billed with D4341 and D4342 for scaling and root planning, D4910 for perio maintenance, and D4355 for full mouth debridement. These codes basically tell a clinical story together. The D0210 is the map, and the subsequent codes are the actual treatment journey.
Okay, this next part is vital. You have to understand the difference between base codes and add-on codes when isolating specific teeth. When taking a periapical radiograph, the one that captures the entire tooth from the crown down to the apex of the root and the surrounding bone, D0220 is your required base code for the very first film, and the documentation must show a crystal clear view of the root for it to be valid. On the flip side, D0230 is strictly an add-on code. You can literally never build D0230 by itself. It always has to be built in addition to D0220 for any extra periapical films taken on that same date of service. Honestly, mixing up this base versus add-on hierarchy is basically a guaranteed way to trigger an instant claim denial, so definitely watch out for that.
All right, Section 3, Decoding Bite-Wing Radiographs.
Bite wings are such a staple of preventive and diagnostic dentistry. Clinically, their main job is to detect interproximal decay. Basically, they find those sneaky cavities hiding right between the teeth that a dentist just can't spot during a standard visual exam. To actually meet the requirement for a bite-wing code, the image must give a perfectly clear view of those interproximal areas and let you evaluate the coronal alveolar bone height. The best part about bite wings from a coding perspective, the flexibility. You can build them totally separately as standalone services, or you can use their add-on flexibility and build them alongside those periapical codes we just talked about, D0220 and D0230.
If you're taking notes for this masterclass, you'll want to jot this down. It's super straightforward. Just map the specific bite-wing code directly to the exact number of films taken. D0270 is for a single bite-wing film. D0272 is for 2 films, and D0274 is what you use when 4 bite-wing films are taken. It's just a simple one-to-one scaling based on the volume of images captured.
Moving right along to Section 4, Panoramics and Frequency Rules.
So here we have the D0330 panoramic film. Now, unlike the intraoral images we've been talking about, the panoramic is extraoral. It captures this huge, sweeping, wide view showing the entire maxilla, the mandible, the dentition, the TMJ, and all the surrounding structures in just one shot. Clinically speaking, you'll see this used all the time on pediatric patients to check out dental development, eruption patterns, and the positioning of primary and adult teeth.
But its usefulness definitely doesn't stop at pediatric development. The D0330 panoramic film is heavily used and consistently co-billed with major surgical procedures. Think about it. If a patient needs surgical extractions or removal of impacted teeth, the oral surgeon absolutely needs that comprehensive macro view. Because of that, you are frequently going to see D0330 billed right alongside the D0200 series, specifically codes D0210 through D0241, which cover all those various levels of surgical extractions and impactions.
Okay, listen up, because this is without a doubt the climax of today's masterclass. This is the 3-year frequency conflict rule, and let me tell you, it is a massive revenue cycle trap. Here's the deal. Most dental benefit plans will cover an FMX, the D0210, once every 3 years. Likewise, they'll cover a panoramic film, the D0330, once every 3 years. But here is the massive catch you need to watch out for. A lot of dental carriers actually consider the D0330 panoramic interchangeable with, or literally a replacement for, a D0210 FMX. So, what does that mean for you? It means if your office billed an FMX 2 years ago, and today you try to bill a panoramic film for that exact same patient, your panoramic claim is almost certainly getting denied right out of the gate due to frequency limitations. You simply cannot double dip on these major comprehensive imaging codes within a 36-month window. Tracking a patient's history here isn't just a good idea, it's absolutely vital.
And that brings us to Section 5, Summary and Next Teaser. Let's do a really quick rapid-fire recap so you can navigate Category I imaging without those pesky denials. First, always remember your D0210 FMX requires 14 to 22 images. Second, strictly follow your base versus add-on rules. D0220 comes first, D0230 follows. Third, utilize your bite wing series D0270 through D0274 specifically for detecting interproximal decay. Fourth, rely on the D0330 panoramic for those big, macro views, pediatric development tracking, or surgical planning. And finally, the most important takeaway of the day, meticulously track that 3-year frequency window. If an FMX was taken in the last 3 years, expect a flat-out denial if you try to bill a panoramic film.
Now that we've totally mastered radiographic imaging and dodged those financial pitfalls around frequency limits, it's time to keep pushing forward. So, are you ready to tackle pulp vitality, caries susceptibility, and oral cancer screenings? We're going to be breaking all of that down in Part 16 as we continue our deep dive into CDT Category I.
Until next time, I want you to ask yourself a serious question. How much revenue is your clinic bleeding right now simply because no one bothered to check the 3-year history before taking a panoramic X-ray? Take these rules, clean up those claims, and fiercely protect your revenue cycle. As always, make sure you like, subscribe, share this explainer with your fellow billing colleagues, and follow the full playlist. Decode Healthcare with Harshal.